Hi, everyone. Thank you for joining us. I'm Jonathan Modi with Oregon Health Authority External Relations. This is a media availability to discuss the press release that hopefully you all saw about the ending of the federal public health emergency and some of the changes that will be happening here in Oregon as a result, and including some things that will be staying in place. As a media availability, we will just basically be prioritizing getting your questions. And so I will provide a quick summary of some of the changes that are happening, and then we will move right to our question and answer period. And you can ask the questions, ask your questions of our speakers who are featured on the call here. So available to answer your questions today are Dr. Dean Sidelinger, Health Officer and State Epidemiologist with Oregon Health Authority's Public Health Division, Colt Gill, Oregon Department of Education Director, Nate Singer, Oregon Eligibility Program Director with the Oregon Department of Human Services, Vivian Levy, Interim Deputy Medicaid Director, Oregon Health Authority Health Systems Division, and Andrew Stolfi, Director and Insurance Commissioner with the Oregon Department of Consumer and Business Services. Just a few reminders. We will take one question at a time. If you'd like to ask follow-up questions, we will take those when everyone has had a chance to ask a question. If you want to ask a question, please use the raise your hand function and you will be added to the queue. If you are not asking a question, please mute your audio. We ask that you include your media affiliation so we know that you are with the media. We did include in the chat, for those of you who were in the waiting room, just a quick reminder about that. So please include your media affiliation. If you don't include your media affiliation, we can't bring you into this Zoom call, and you will need to join the YouTube live stream, where unfortunately you won't be able to ask questions. And also if you are not with the media, please use that YouTube live stream at the link included with the advisory for this briefing. And I believe we have the YouTube link included in the chat as well. So we will grant permission to record this briefing one by one. It does take time, so we appreciate your patience after you ask for permission to record. If you have audio issues and can't ask a question, feel free to drop it in the chat, and I'm happy to ask it on your behalf. And then for the benefit of our ASL interpreters, I ask that all reporters please speak slowly. I just caught myself, I realized I haven't been doing that. So please speak slowly for our ASL interpreters. Lastly, a recording of this media briefing will be at the YouTube link shared in the advisory for this briefing. So in other words, the live stream link will become the recording. And if you have any questions, feel free to send a note to phd.communications@oha.oregon.gov, or feel free to email anyone, any of the communication staff who were included at the top of the press release that was sent this morning. Now I just want to provide a very quick overview of what is changing. If you give me one moment. Okay, hopefully you all can see that. So some of the key policy changes that we are announcing today.
Jonathan, I don't see slides.
Oh, sorry about that. Let me just, I think I failed to click a button here. There we go. Can everyone see that?
That works. Thank you.
Okay. Thanks, Dr. Sidelinger. Okay. So the key policy changes happening today includes vaccination. Oregon is lifting the vaccination requirement for healthcare workers. Oregon is lifting the vaccination requirement for K-12 workers. And Oregon is keeping a requirement that commercial health insurers reimburse out-of-network providers for COVID-19 vaccines. Another key policy change is in reporting of COVID-19. OHA will no longer report COVID-19 cases on a weekly dashboard. We also will no longer require reporting of COVID-19 tests to local public health authorities or county public health departments. And OHA will no longer require, but will still encourage that providers collect data on race, ethnicity, language, and disability, also known as REAL-D, during COVID-19 encounters with patients. And finally, in the area of exposure, COVID-19 exposure, isolation, and testing, Oregon is lifting the 5-day recommendations and requirements for isolation of positive COVID-19 cases in the general public, including K-12 schools, and the weekly opt-in screening for K-12 students and staff with COVID-19 symptoms will end on July 31st.
Jonathan, just be clear, that's without symptoms.
I'm sorry, without symptoms. Apologies. Yes, thank you, Director Gill. Again, weekly opt-in screening testing for K-12 students and staff without COVID-19 symptoms will end July 31st. And with that, I will open it up to questions, and we will just take questions as they come in. And it looks like the first question is from Ben Botkin with Oregon Capital Chronicle. Go ahead, Ben.
Thanks. I was hoping maybe you could give me a sense of just how will the state track COVID cases or determine whether or not there's a spread if cases aren't being reported to the health authority? Thanks.
Thank you for that question. This is Dean Sidelinger with the Public Health Division in Oregon Health Authority. I think what we're going to do going forward is track the spread of COVID-19 similar to how we track influenza and RSV. We have many tools at our disposal. We have providers and labs from across Oregon that voluntarily report in COVID tests done in a week and the number of those tests that are positive. So we'll be able to continue to track percent positivity across Oregon, which is a good indication of spread. When percent positivity goes up, that's an indicator that more people are seeking care and levels of transmission in the state are higher. We will continue to do wastewater sampling across many communities in Oregon. This allows us to detect COVID-19 spread in the community and the level of spread in the community, regardless of whether people seek care or get testing. We can also do genomic testing of those samples, and that will allow us to track variants that are in various communities. Our laboratory providers, when they do testing, will continue to send in specimens for genomic sequencing, and those will be tracked as they are now, and we will report on percent of variants that we're seeing on an ongoing basis. Our focus will continue to be on serious disease, so we will track hospitalizations with COVID-19, the impact on hospital capacity from COVID-19, as well as deaths from COVID-19. So that data will remain available on our website, will be updated on a weekly basis, and allow us to share that information with you and members across Oregon. Vaccination numbers will also continue to be tracked on a weekly basis with breakdowns by county, age group, and race and ethnicity so that people can see what vaccination rates are in their community. These changes are in alignment with most of the changes that the CDC was implementing with the end of the public health emergency, though they will no longer be tracking percent positivity at the national level like we can continue to do here at the state.
Thank you, Ben. Next question comes from Gary Warner with EO Media. Go ahead, Gary.
Good morning. What will be the first things that the average person would see out of these changes today on May 11th? We've talked a lot about them, that they were coming. We've heard a lot about like the Article 42 down at the border and things like that. But is there going to be anything that will pop up in people's lives that's new based on what's happening today?
This is Dean Sidelinger. Let me start with the public health recommendations that Jonathan just laid out. You know, what we will see is individuals who work in healthcare settings, that rule will no longer be in effect to have your primary series of vaccines, but we still recommend that those workers be up to date with their recommended vaccines. That offers them the best protection and will keep them safe from severe disease. That requirement will be lifted in K-12 settings, so those staff will see a change in that vaccine requirement as they move forward. I think individuals in general will still have access to data about the spread of COVID-19 in Oregon, and those that spread is lower now than it has been in a long time. Individuals will see more impacts on their coverage and access to benefits. And with that, I think I can turn it over to Vivian or Nate. I'm not sure which one wants to take the first crack at that.
Hi, everyone.
Go ahead, Nate. You start.
All right. Hi, everyone. Nate Singer with the Oregon Department of Human Services. One of the other changes that people have started to see already is with the ending of the public health emergency, we've started to do medical redeterminations again. This is a historic level of work as we look at this. We are doing redeterminations for medical programs for 1 out of every 3 individuals in this state. And so while we're doing this work, individuals will start to receive notices and have to provide us updates around their cases. So that way we can make sure they're receiving the correct benefits and can continue to receive and have access to their medical determinations. As well, there are some changes that continue to happen around food benefits. We saw the ending of the emergency allotments that were supporting individuals in the state. That was during the pandemic and during the emergency period, we were able to provide additional dollars for individuals that were eligible for that program. And so at minimum, they saw a $95 increase during that period of time. Many saw much more than that. That reduction has already taken place for individuals in the state. And so as we continue to work through these requirements, we continue to reach out to individuals and ask that they respond to us, look at our information and make sure that they're keeping their information up to date so that way they can be aware of these changes as we move through and make sure we can move back to those pre-pandemic rules around how we deliver these benefits.
Can you talk a little bit more about that process? I happen to be one of those people who gets those letters in the mail, and they're big, thick packets that, you know, you want information about earnings and all these other things. And it seems like it's very, on one level, very intrusive, but also very scary in that it doesn't seem to say what that I would send you would trip my falling off of the program.
Thank you for that question. And as I answer parts of this question, I want to note that, you know, each of these programs has nuances. And so if there's specifics, we can always talk offline or make a connection related to some of the specific program situations. For the redetermination process, as we send information out, we attempt to reach out to people in multiple ways. We're required federally to request information from individuals every 12 months for most programs. In some cases, it's every 24 months. And in some cases, we have to do additional reviews at 6 months. So there's a lot of complexities to these programs when we engage with individuals. But as we engage there, we have to collect information around the family, all the individuals related to the cases. We have to look at additional information around non-financial, where you live, what type of situations, who you may be preparing food with. These questions can be really personal. They can feel intrusive. And so we try to do it in the most open way possible. Your information you provide to us is kept in a single system. we keep it securely. And as we do interviews, our goal is really just to make sure we're providing that accurate and timely redeterminations. And as you mentioned, some of these questions are around financial information. These can be complex, and we don't expect individuals to know all the things that potentially could trip them up or what is necessary inside there. That's where eligibility determination is more than just processing it. As we get a chance and as we send information out there, we continue to want people to please reach out to us. And as we do interviews, ask those questions. We want to take the time to make sure your information is correct. You understand what your eligibility determination is saying. You can review the information we put in there and provide us with updates if anything we've captured is not correct throughout the determination process. And as Vivian can share a little bit from the Oregon Health Authority and some of the rule changes they made around timings to allow additional time, I always encourage individuals, if you receive a notice and you have questions, you can call our One Customer Service Center 800 number. You can also reach out to any of our aging people disabilities, area agency on aging, or self-sufficiency offices that are in your local communities throughout the state. And they can go over what we saw in the case, review information, and make sure that ultimately you have the information you need. The final thing is really making sure that if someone does see a reduction in benefits or a closure, and again, reviewing it, providing hearing rights, we also want to try to direct to other community resources. We know that these changes can be complex, and this is the first time in several years that both our staff as well as individual states are working through these processes. So we really want to be as proactive as possible. So please continue to keep your information up to date so you can get those notices. And then please, reach out to our departments and work with us so we can help answer any questions that you may have through the process.
Real quick, just one thing is that there's been a lot of reports that people aren't able to get through to have their questions answered. So, it's great to put in a story that, reach out to people, call, you can get information, but how are you doing on just picking up the phone, having enough people to pick up the phone and enough trained people to be able to tell people what's going on?
Yeah,
That's it for me. So thank you for your patience.
Thank you, Gary, and appreciate the question. As we look at unwinding the COVID emergency, we knew it was going to bring a record amount of work into the Oregon Department of Human Services, primarily because we must review the medical program eligibility, as I shared, for 1 out of every 3 people in the state of Oregon, while continuing to complete applications for benefits and redeterminations for other critical benefits related to food, cash, and childcare. We've been preparing for this influx of a historic level of work over the past year, and we've done a couple things that hopefully will help mitigate some of these steps. One, the Oregon Health Authority was able to contract with a third-party vendor, PH Tech, to increase their capacity on phones. They are now up to around 200 additional staff that can answer questions and assist individuals in providing us information, so our staff can focus on what they're required to do in renewing benefits. We added a callback option to our One Customer Service Center. It's our 800 number, so people don't have to stay online. They can have a callback, and so that way, while call times may still take longer, they don't have to stay on hold throughout that period of time. We've also added additional text messaging and other notifications ways, so that way we can reach out or remind people about important dates, such as when their appointments are due, requests for information that are coming due, or when we have returned mail and we need to update their mailing addresses. So these are some of the things we try to do around this. However, as we've taken as many steps to prepare as possible, with the large number of Oregon Health Plan redeterminations, along with renewals for long-term services and supports, we do expect our wait times to continue to not be where we want them. We're reporting those out. You can go on to our benefits.oregon.gov website, and there's a dashboard on there to see those timeframes, but we know there will be some delays and possible interruptions for individuals. To assist through that, a couple other things I just want to make sure everyone's aware of. Again, you can go to any of our aging and people disabilities, area agency on aging, or self-sufficiency program offices. These are throughout the state. You can call them as well and schedule appointments there. You can apply online and provide information through that as well. We are just releasing now the Oregon One mobile application that allows individuals to provide updates and see their documentations as well. And we just really encourage people to be as proactive as possible as they look at their information. If they can keep their information up to date, And as they get notices, please engage with us as soon as you can in the process, so that way we can make sure that we have time to work with you through this process. We know it's not an ideal situation as we work through every area related to it, but we're going to do our best possible to make sure our staff are available to answer the calls and make sure we have as many paths and opportunities available for you to get your information into us.
One important point that I want to make sure to add, this is Vivian Levy, interim Deputy Medicaid Director for OHA. The eligibility process is very complicated. It's very difficult for people who are experts in it to understand, let alone people who are going through it and trying to figure out what these things that we're sending mean. It's our job to make it as simple as possible. It's our job to only ask for the information that we absolutely need to be able to determine eligibility. I think that we continue to make strides in that, but certainly it can still be very complicated, and the notices and information that people get can be hard to understand. And because of that, I just want to make sure that everybody is aware that we have this incredible community partner network across the state who are not state staff, but are trained by the state in how to assist people with the application process, with understanding what they're being asked for, with navigating the process of getting information. We have folks who speak many different languages, who can support many different schedules. When you're thinking about the capacity that we have to support people, our community partner network, which at one.oregon.gov, there's a search feature that you can use to find community partners based on all sorts of different filters and information. And those are just incredible resources, especially when the state is in a situation where there are not as many resources as we wish that there were to process these applications and answer phones. They're a great place to direct people to get help.
Okay, thanks everyone. Thanks, Gary. Next question is from Daisy at KGW. Go ahead, Daisy.
Hello, everyone. Yeah, so I'm a little curious to hear what the updated exposure isolation guidelines are if someone contacts COVID moving forward.
Thanks. What we are recommending that individuals who have COVID-19 or suspect they have COVID-19 is that they stay home while they're sick and while they're getting better. If they have a fever, wait till their fever resolves and their symptoms are improving. That does not mean a person is no longer contagious. The same way as a person who reaches day 6, after testing positive, doesn't mean that they're no longer contagious. So we ask individuals that if they've been diagnosed with COVID-19 to, again, stay home while they're sick until they've started to recover. And in those 10 days after they got sick, to consider limiting their contact with others who are particularly at high risk. And that they can consider wearing a mask around others, because that will help protect your loved ones, neighbors, and other folks you come into contact with. These are similar to recommendations we make to folks who are recovering from influenza or RSV. And we feel that this is the best response and evolution to our guidance as we enter this phase of the pandemic. This will be similar to folks who were with us about a year and a half ago, where we stopped recommending that people who were exposed to someone with COVID-19 stay home in case they got sick. This is a continued response. So if you're sick and or you've tested positive for COVID-19, please stay home and take care of yourself. As you start to feel better, please think about who you're going to be around in those 10 days. Consider wearing a mask or changing your plans for those 10 days. This will impact the general population. It will also have an impact on schools and get more of our folks in school on a regular basis for in-person instruction. And we don't think will significantly lead to increased cases in schools. Many folks who are getting sick right now with COVID-19 don't have symptoms or don't know they're sick, and they continue to go out their business. So this is really going to impact just a small subset of folks who are sick with COVID-19 and some of the length of time that they have to stay home. But I think it'll help our students in school have consistent classroom instruction as they get through this next phase of our response to the pandemic.
Thank you, Daisy. Next question is from Lillian at OPB. Go ahead, Lillian.
Hi, thank you. My question is around some of the federal programs that will be ending, and if there's any of them that Oregon as a state is going to be able to extend, specifically the, you mentioned with all the redeterminations that people with disabilities are going to be coming into those redeterminations. I'm wondering if the program that supports parents to take care of children with disabilities and some of those other supports, if anything's going to be happening with those in terms of extension.
Thank you for that question. I'll jump in, and then if anyone at the Oregon Health Authority wants to add related to this. So as we look across programs that exist federally, many of these areas are continuing to be looked at. You mentioned specifically around a wonderful service and program to be able to assist parents as caretakers for individuals with intellectual and developmental disabilities. That was always a temporary program and communicated that way. That being said, it's currently with the Oregon legislature to determine whether or not that program can continue and if it could be funded. If it is funded through the Oregon legislature, we will need to get approval from the Centers for Medicaid and Medicare Services, CMS, to operate the program in the state. But we are preparing if we do receive approval for funding and can get that federal approval to continue to look at those opportunities. In the meantime, I just want to let people know that we're continuing to work with our county developmental disability programs and those case manager entities to be able to support the families that were utilizing those services to make sure they can have access to other services if it isn't able to continue in the timeframes that we would like to see.
Okay, and then 2 questions. Are there other programs like that one that are also, have made it to the legislature as a possible, like legal change to the, what am I trying to say? I'm stumbling over my words. Sorry, everybody. Is there anything else that's made it to the legislature that we saw happen during COVID and was a support people like, and is maybe going to be a change in the future, but you're not, we're not sure yet? Or is that the main one that jumps out?
I don't know, Vivian, if you want to take a moment to talk about the basic health plan, and then we can see if there's anything else that other programs want to mention.
Yeah, absolutely. So House Bill 4035 is a bill that came out sort of to help direct what would happen during the unwinding before we knew when the unwinding would take place. And part of that was thinking about how to help ensure that the gains that we had made in coverage in Oregon were not lost during the unwinding. And so one of the strategies outlined in House Bill 4035 was to create a bridge to a basic health program. And so the way that what we're in the process of implementing right now is we have a temporary Medicaid program that has been approved by our federal partners that people between 139 and 200% of the federal poverty level who are otherwise eligible are able to move into that temporary program when they're redetermined during the unwinding. So whereas they would have otherwise lost coverage for Medicaid, for Oregon Health Plan, and moved into the marketplace, this group of folks will be maintained in this sort of bridge program temporarily until a basic health program is established next year, at which point we will take the folks in that temporary program, that bridge program, and move them into the basic health program. So that's really the thing that comes to mind in terms of a legislative bill that came out of the public health emergency that has kind of changed the way that we're going to do things moving forward.
Great, thank you. And is there an end date is the May 11th federal lifting the end date for all those programs? So like the actual money people have been getting to support, say, their children at home who are suffering with disabilities, that will be over as of May 11th, is that right?
I believe that is right. As we look at the allowances that we had associated with it, if there's additional questions, I can make sure we have a connection with our Office of Developmental Disability Services, and we can follow up with some additional information if that would be helpful.
Thank you.
Thanks, Lillian. Next question is from Devin at KGW. Go ahead, Devin.
Hey, thank you. I had just a quick question, more of a clarification, and then another question. I guess 2 questions if you want to go with that one. So the new state changes about lifting the vax requirements for healthcare workers and for K through 12 workers, that starts tomorrow. The federal public health emergency ends after the end of tomorrow. So is the lifting of the vaccine requirements ending before the federal public health emergency ends?
Thank you for that clarification. This is Dean Sidelinger. In Oregon, the state rule requiring vaccines for healthcare workers will lift tomorrow. So it will end it'll be in force through May 10th and be lifted on May 11th. You're right, the federal public health emergency ends at midnight tomorrow, and many of the rules and program changes that were implemented as part of that emergency will expire at midnight. Currently, on the federal level, CMS, the Center for Medicare and Medicaid Services, has a rule requiring primary COVID-19 vaccine series for CMS regulated facilities and their staff. There is indication that they're working on repealing that rule, but there's been no official announcement yet. So individuals in healthcare settings, the rule for vaccine requirements from the state of Oregon will lift tomorrow, Thursday, May 11th. For volunteers, staff, and other staff, including teachers in K-12 settings, that rule will lift on Saturday, June 17th. This is an attempt to minimize disruptions to in-classroom instruction based on that rule through the rest of this school year. So that's why the delay is in place to assist our education partners in making those changes.
And then I'm just curious, with this ending, or 3 years past, or more than 3 years past, when the first COVID case, entered here in the U.S., kind of how you would grade Oregon's response to the COVID-19 pandemic and the emergencies that were now being lifted.
Thank you. I think, all of us involved in this response can look back on things that, knowing what we know now, we may have changed. But I think we have to look at some of the critical outcomes and how we compare to other states and feel good about our overall response. The age-adjusted death rate in Oregon was one of the lowest amongst states across the country. And I think that's due to the policies that were put in place, the actions that Oregonians took, the actions of our public healthcare, education colleagues, our community-based organizations, folks who supported individuals through this pandemic. Those lives lost represent tragedies for the families and the loved ones they left behind. But in many states, those numbers occurred at much higher rates. And so in Oregon, we need to be proud of the actions we took that saved lives. When we look at the overall response, the hospitalizations and other impacts, a Kaiser Family Foundation study last year showed that the Oregon response was one of the best in the state in terms of minimizing impact on healthcare settings. Again, we evolved our response as time went on, as we learned more things about the spread of COVID-19, the serious impacts from COVID-19. We had additional tools such as vaccines and updated boosters to respond, that we do things differently now than we did a year ago than we did 2 years ago. The legislature commissioned an independent report that looked at some of our actions, and those first 2 reports have been completed by the Reed Group. And we will continue to look at that and talk with our partners about additional lessons learned for the next time we have to face a pandemic like this, so that we can improve our response from the start.
Thank you, Devin. That is it for the raised hands. Just give it another opportunity so folks can raise their hand to be added to the queue. And if you have any need for me to ask a question on your behalf, please just drop your question in the chat, and I'm happy to do that. We do have a question from Fedor at the Oregonian. Go ahead, Fedor.
Hi, thanks. Just real quick. So to follow up on that forecast Peter Graven did a month ago with anticipated 500 hospitalizations beginning in May into June. What's the status with that? Is that still something OHA anticipates will happen?
Thank you, Fedor, for that question. This is Dean Sidelinger with Public Health. we haven't seen an updated forecast from Peter Graven since that report came out last month, and we anticipate that those will happen on a monthly cadence. When that report came out, we said that we anticipated that we might see some changes to that estimate in June. Those hospitalization numbers were based on some limited data, and forecasting that far out can be difficult because there's a lot more uncertainties in it with the variants that are circulating and the level of community immunity from people who've recently recovered or have been vaccinated. So we'll keep an eye on that. What we know now is that we look at the number of people hospitalized with COVID-19, we're at some of the lowest rates that we've seen in a year. We know that there are many people who report being sick, either with symptoms of COVID-19 or have tested positive for COVID-19. And we see that we're still detecting COVID-19 in our wastewater, but that's been at a fairly consistent level, but we're not seeing an increase in hospitalizations. So we'll continue to watch those indicators, look for an updated forecast from Dr. Graven, and change our messaging so that people can make decisions based on what's happening in the community to protect themselves and their loved ones. So we'll continue to monitor that and share the information out to help people make those decisions.
Thank you.
Thanks, Fedor. It looks like that is the last question. Give it 1 minute here to see if anyone wants to sneak one in.
Jonathan, I don't see any hands, so I'll just say a couple of things.
I was just going to say no takers, so I'll go ahead and pitch it over to you, Dr. Sidelinger, to close us out.
One, let me give a thank you. I don't always get to do this, but to our ASL interpreters for helping us get this information out to individuals in our community, and to all of you for helping to get this information out. Last month when we did our last scheduled briefing, I committed to coming to you when we had changes. I'm grateful to my state colleagues from across various agencies to come here to try and provide the most up-to-date information we have that reflects changes at the federal level from the end of the public health emergency, as well as changes we're implementing here at the state. For individuals, we will continue to publish data that shows the spread of COVID-19 in Oregon, including its impact on hospitalizations and the severe disease we're seeing. This information will help people to make decisions. But my message for everyone right now is look at your COVID-19 vaccinations and be up to date with those vaccinations, as that offers you and your loved ones the best protection. If you've not yet received a COVID-19 bivalent booster, please get that. If you are an individual who's at higher risk of severe complications because you're immunocompromised or over 65, and it's been 4 months since your last bivalent booster, you can get a second bivalent booster. This will continue to offer you protection from severe disease and death as we go through the summer. I anticipate in the fall, we will have updated boosters available, and we'll encourage you to get those along with your flu shot. For individuals at higher risk, or if you're sick or recovering from a respiratory illness, wearing a mask offers great protection for yourself and for those around you. And if you do that in indoor public settings, if disease rates go up again, that'll ensure that you and the loved ones you return home to can stay safe. But right now, disease rates are lower. The changes we're making are reflective of that. And we move into a period where we can sustain our response, provide information to people to make decisions to continue to protect themselves as we have to live with COVID-19 going forward. So thank you all for helping us get the word out. And thank you again to all those Oregonians who continue to take precautions. And my thoughts go out to those individuals who are currently recovering, caring for a loved one, or mourning the loss of a loved one. We've all been impacted by COVID-19, the disease itself, as well as some of our responses. But I think in Oregon, we need to be proud of the outcomes we've seen and the lives that we've